Hello, listeners. Thanks for tuning into the Spark Medical Education for Curious Minds, where we present the people and stories behind medical advances at UCSF, including those led by medical students, physicians, and faculty in the School of Medicine. Through the Spark, we share the innovations at UCSF that are helping bring more equitable and better care to our communities. I'm Karen Fleming, Communications Manager for the Office of Medical Education.
And I'm Greg Gadwood, Instructional Designer for the Technology Enhanced Education team.
In this episode, we feature UCSF initiatives aimed at incorporating the social determinants of health. We'll hear from Dr. Dan Dohan, Professor of Health Policy and Social Medicine at UCSF. Dr. Dohan will discuss advances in research, prevention, and treatment for Bay Area residents struggling with issues such as homelessness, mental illness, or inadequate nutrition. We also talked to first-year medical student Hannah Borowski, who completed electives in the Bridges curriculum Health and Society block on the social determinants of health. So I'm here with Professor Dan Dohan, and we're speaking about his work in health policy and social medicine. What sparked your interest in research and health initiatives aimed at caring for some of the people in the city's most vulnerable communities?
My interest really goes back to some of the work I did as a graduate student in sociology. And I wasn't studying health then. I actually was studying how people in low-income communities earn their income on a day-to-day basis. And I spent about 2 years living in a couple of different low-income communities in California. And the experience was really eye-opening. It made me appreciate much more concretely and sort of specifically things that we now call the structural determinants of health, how things like housing and food insecurity, violence, and police criminal justice systems impact people's health. And that's really where my work and interest in the field began. And here at UCSF, I've done a lot of work on similar topics, sometimes closer to the healthcare system, things around how low-income folks get cancer care or receive care for other types of chronic and serious conditions.
And what do you see as some of the toughest challenge or most important challenges in bringing better care to people that really need it in the Bay Area?
One of the things that I sort of learned from my work in sociology was how deep set these problems are, how difficult it is to actually address the inequalities that are pervasive in health, how hard it is actually to make lasting improvement in health for people. And I think that coming to UCSF and getting involved in medical school, part of my thinking was this is not a problem that sort of one person or one generation of people is going to be able to successfully address. It really requires a sea change in how we think about our communities and how we think about what it means to be inclusive and how we think about equity. And I think partly that's why, since I've been at UCSF, I've been spending a lot of time thinking about educating future physicians and future policymakers so that they're more sensitive to these issues. How hard it is to make lasting change has made me think we need to be sort of preparing other people to do that and to move this forward.
And in terms of preparing the future physicians that will be caring for some of these vulnerable communities, you serve as one of the directors of the Health and Society block for the Bridges curriculum. Can you speak to some of the work involved in planning some of the courses or electives so that we are preparing our learners to be better equipped to deal with some of these challenges?
Yeah, I mean, I'm really proud of the work that we've done in Health and Society. I'm incredibly grateful to be at UCSF and that the university has invested in developing this course. I don't know of another program like it at other medical schools. And I think what's unique about it is we think a lot in Health and Society about how to make future physicians better able to care for diverse patients and care for vulnerable patients. But we also try to sort of take it another step and help students think about how to become effective advocates for change and address some of those underlying problems that I saw, those underlying structural issues that I sort of saw as a sociologist and saw during my field work. And that's really, for me, one of the big differences in the Health and Society course, that we are thinking not just about how one physician cares for one patient and does a fabulous job in that domain, which we want to happen, but also how a physician can think beyond their role in the clinical setting and think about how do they provoke change in the healthcare system so that broader numbers of vulnerable patients have access to appropriate care, or how do they make changes outside of the healthcare system? How do they help people get better housing, live in safer communities. These kinds of big issues that we know are the true drivers of health. Physicians have a really potentially important role to play in addressing them. So that's really what Health and Society is trying to do, is trying to give students right from the beginning of the medical education, the tools to think about those problems and those challenges and the opportunity to think about how they themselves could address them in their career.
Could you speak to a recent moment in, you're teaching these students in the Health and Society block during which you were particularly inspired or excited by some of the knowledge that you see growing in these learners?
So where we are right now in our political climate in the country is, there's a lot of stuff happening. And one of the things that's occurred in the last few weeks has been a lot of activism around gun violence. And the students actually came to us before the course began and wanted to talk about this and wanted to educate us about the kinds of activities that they were doing, that they had self-organized around addressing gun violence, around speaking out, around sort of making a movement in that direction. And we were then able to sort of actually transform the curriculum to address those issues. So that one of our small groups that we just concluded this week specifically addressed this issue of gun violence and brought up not just sort of the need to do something because it creates a lot of harm, which obviously gun violence does from a health perspective, but also why it's such a hard issue to address, why we've struggled to reduce gun violence in this country for many, many decades. So that for me was a terrific example of students being activated, wanting to do something to address a problem that they see as a very important and serious problem, and then partnering with us as faculty to figure out, what can we learn from this? How can we grow from it?
What are you most excited about in terms of your own work in health policy? And if you want to speak to the research as well, then please do.
There's another educational program that I'm involved with, which is training people to be better users of health policy and legal knowledge so that they can affect social change through that, and that's a master's program level. So one thing I'm excited about is that these issues are resonating with lots of different student communities, with medical students, with these master's level students. And then some of the work that I'm starting now, is really trying to understand people's stories of inequality and the kinds of issues that they encounter in the healthcare system that are hard to represent in sort of facts and figures in the usual numeric way, but that really come out in people's stories. And when you sit down and talk to someone, and the current project we're working on is around the struggles that people have to get cancer medicine, which is some of the most effective cancer medicines are, these amazing new therapies that are based on, addressing specific mutations in genes in cancer, and they're incredible. They can bring cure, or they can bring, lasting remission to patients. They're also incredibly expensive, and there are a lot of reasons why they're expensive, but that creates a lot of burden, especially for low-income patients. So this project that we're starting is really thinking about how to understand that process better and how to get those stories from patients that will allow us to understand what they do to deal with the fact that sort of these medicines are unaffordable, or there's other struggles that they have in staying adherent to their medication and really continuing to enjoy the benefits of these new technologies and these new therapies. There's also the need to make it sort of patient-centered for specific types of vulnerable or disadvantaged patients, so that we appreciate what patients do to maintain their health, even when it's a struggle for them, and that we can then sort of support them as best possible.
It's inspiring to know that faculty such as Dr. Dohan are exploring the social determinants of health and incorporating these aspects into the Bridges curriculum at the School of Medicine. I'm intrigued hearing about how components of the curriculum help prepare students to better understand and address the social determinants of health. Are there any examples that illustrate how students are applying this knowledge?
For a student's take on this, let's hear from Hannah Borowski as she describes how courses and electives in the curriculum are helping learners prepare to care for people in vulnerable, under-resourced communities across the Bay. I'm here with first-year medical student Hannah Borowski, and we're talking about the health and society block in terms of the context of caring for the city's most vulnerable communities. So Hannah, what sparked your interest in health initiatives aimed at caring for the Bay Area residents most in need?
My classmates and I are beginning our medical careers at a moment in time when, as compared to a white child born in the Oakland Hills, a black child born in West Oakland is likely to die about 15 years earlier, 5 times more likely to be hospitalized with diabetes, 2 times more likely to die of heart disease, 7 times more likely to be born into poverty, and 3 times more likely to be shot by the police. This is what I care about because, as a future physician, it is my job. I want to be part of building a healthcare system that centers on best serving people who have been placed at the margins by our current approaches. We know that the social determinants of health, factors like your economic stability, your neighborhood environment, your educational opportunities, your social and community context, your access to healthcare, they influence your health to a far greater extent than biological factors. But to truly address these social determinants of health in a meaningful way, we must address the structural factors that underlie the social determinants of health. These structures concentrate poverty and trauma in marginalized communities, leading to poor health outcomes. The more I wrap my head around these ideas and the structural nature of inequality in our country, the more I realize that the most powerful ways we can use our voices as medical students and one day as physicians is by working to address the structural underpinnings of the social determinants of health.
So the Bridges Curriculum Health and Society block exposes first-year medical students to foundational science in the areas of health determinants, health disparities, and health policy. What have been some of your key learnings after taking courses or electives in this area?
The Health and the Society block has presented an exciting opportunity to engage with structural determinants of health. Our federal government attempts to dismantle healthcare reform that extended health insurance to 20 million previously uninsured Americans, and even as is, the system fails to provide universal care and leaves patients with significant financial burdens and unmet medical need. We're entering medicine at a time when pharmaceutical drug prices are set with little government regulation by for-profit companies worth billions and billions of dollars, while funding for NIH research continues to decline. Our country experiences a larger gap in health status between the wealthiest and poorest citizens than nearly any other middle or high-income country. These are topics that we discussed in the Health and the Society block and that we really got to dig into from our position as trainees and to think about as we enter medicine how these structural issues will affect patient care.
So what have you observed at UCSF as a whole, or specifically in the School of Medicine, as new advances in equitable care delivery and health policy that you've found particularly inspiring?
I'm perpetually inspired by my classmates. They're doing incredible things to promote equitable care, both through direct service projects as well as through advocacy and activism. I've seen this through the free clinics that my classmates run and volunteer at. These clinics are often visited by patients who have had negative experiences in other parts of the health system, and the goal is really to provide a different type of experience. At Clínica Martín Barro in the Mission, run both by UCSF students and SFU students, there's just this incredible vibe in this clinic that is unlike any clinic I've ever been to, where there's education that happens in the lobby and there's sharing of stories and there's just real time spent with patients. And so seeing things like this, the ways in which my classmates, as they've stepped into leadership roles in these free clinics, are innovating and coming up with really creative ways to provide really high quality and different care has been really inspiring. Along with classmates, I've learned a ton and just been blown away by advocacy efforts through the White Coats for Black Lives group. And this has really given us a chance to think about more structural issues. Earlier this year, we had a rally in support of DACA recipients and their families. And really in all of these cases, thinking about how these issues affect health and well-being and how we can use our voice as medical providers and medical trainees to promote more equity. I've also seen my classmates lead really exciting efforts in the area of medical education and in thinking about how we train the next generation of providers to provide different and more equitable care. And most recently, a number of my classmates started an elective called Dialogue to Action, which is completely developed and facilitated by classmates, that is spurring important conversations and learning and growth around issues of identity and conflict and advocacy. And it's so exciting to see at all these different levels, from direct service to activism and advocacy efforts to educational efforts, the ways in which my classmates are leading and innovating. I've also been really inspired by many of the neat programs at UCSF. One example is called the Wraparound Project at SFGH, which is a violence prevention program which connects patients who are in the hospital due to injuries related to violence and helps connect them with resources and support to sort of end this cycle of violence. And I've also learned in this work that providers have to nourish themselves and have spaces for healing and for self-care, because we can't be good healers unless we're actively caring for ourselves.
So how do you plan to apply all this knowledge in your future medical career?
Well, I'd say the next step for me, as I finish preclinical training and then go onto the wards for the first time, I see a huge opportunity to learn from actual experiences with patients. And we've gotten some of that in medical school so far, but the immersive experience of spending all day, every day seeing patients, I think will be a really incredible opportunity to see what this looks like in action, how you find the language to talk about the social determinants of health with your patients, how you talk about the structural factors that influence the social determinants, what it looks like in action, and the experiences and knowledge and wisdom that patients bring. I hope to practice in underserved communities and to be a clinician and also an activist and an advocate and a medical educator. And to me, those three things go hand in hand really in a really exciting way. Medical education represents this incredible lever to think about systemic change in the health field, and to have mentors here at UCSF as well as elsewhere who are boldly using their voices and power as physicians to address the structures that perpetuate health inequities.
The enthusiasm and passion that both Dr. Dohan and first-year student Hannah expressed about their work to address the social determinants of health prompt me to think about the health and wellness of our communities in new ways, and it's inspiring to learn that this work is embedded in the way care is delivered at UCSF and how it's implemented into the medical school curriculum. We hope you're subscribing to The Spark on SoundCloud. Stay tuned for our next episode, which will explore new advances in treating people with sleep disorders.
The music in this podcast comes from Poddington Bears Egress, licensed under CC BY NC 3.0, and available at the Internet Archive.